My name's Maria and I am an educator with the Drug Education Network. So that means that I provide training and resource development for community members, schools, community workers throughout Tasmania. It's really important that we give young people really good information so that they can feel informed in terms of the decisions that they're making, that they understand the effects of drugs, they understand about overdose risk and how drugs can affect not only our body but also our mental health as well. So for us it's about, without judgment, providing good information so that people can feel really well informed. It is important that young people know where to find good information and that they know that it's important to be able to look after each other and to talk to people that they trust and to be able to access that information when they need it. You know, the topic of drug use can be quite a stigmatised topic in our society. Sometimes it can be hard for people to talk about the issue or feel it's okay to get information, but we know that good information saves lives. Young people are using less drugs. They're waiting till they're older before they start using. But then we also have some situations where there is still risky use happening for some groups of people. So I guess it's important that people have that information so that they can really reduce the harms. An overdose happens when someone has consumed too much of a particular drug, and that might be because of the potency or the quantity. And it can also happen if a combination of drugs has been consumed as well. Often young people don't realise that alcohol is a drug and it can cause overdose. Often people think, oh, it's heroin that is the only drug that causes overdoses, but any depressant drug can cause an overdose. And so that can look like being non-responsive, being really sleepy, wanting to lie down. Snoring is often a sign of overdose. So if you see any of these signs, it's really important that you stay with the person, and if they're non-responsive, put them in the recovery position and call 000. So when you dial 000, you will be asked if you need ambulance, fire service, police, so you need to let the caller know. And so then you'll be directed to the ambulance service. They want to know where you are, who you're with, is the person conscious or unconscious. If you know what they have taken, it's really useful to provide that information. And so then the responders can attend the scene and support that young person. The ambulance service are not necessarily going to call the police if there is drug use involved. For them, the priority is providing that care for that person. They don't want that to be a barrier, and because of the stigmatising issue of drug use in our community, they recognise that can be a barrier. There are some situations where the ambulance may call the police, but the main reason for that is if they are concerned about safety for the paramedics, because they want to make sure the paramedics can provide that help and assistance for the person who has overdosed. If the person is unconscious, it's important that they place them in the recovery position. It's also important that the person stays with them so they're not left alone. They need to ensure if the person has experienced a depressant overdose and they're non-responsive, to try and communicate with them, stay with them, and also keep them warm. If the person has experienced an overdose from a stimulant drug, such as amphetamines, for example, that person may be quite agitated, they may be experiencing chest pain, they may be feeling quite frightened. And so it's also really important to remain calm, use a quiet voice, and just ensure that the area is also quiet and that that person can be looked after until the paramedics arrive. Remember that your safety is really important as well. And so you need to make sure that you're looking after yourself, but you're also providing reassurance in a calm tone of voice. And it's also useful to think about how someone who's experiencing an overdose may be responding. And so that could mean it's important that you don't smile or you don't use a loud voice. These things can seem threatening to someone who may be experiencing a stimulant type of overdose. But the main thing is to stay with the person if it's safe to do so, provide reassurance, keep them warm, and make sure there's not too much stimulation in the area. I think as an educator, for me, I see that good information does save lives and it prevents harm. I think it's really important that young people know that they can get the help that they need, and so for me, it's important to be able to provide good information and really encourage young people to reach out and get that support, whether that's in relation to an overdose or whether it's about their own substance use.